Hours are all about empowering, educating and giving space to black people so our communities can look after themselves better. Every Saturday, our black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Okay, welcome everybody to another CAHN Health Hour. This is Saturday, the 16th of October. I'm your host, Dr. Abiye Hector-Goma, and I'm sitting outside in my garden because it's lovely, and I'm in Manchester, and we rarely ever have weather like this, so I'm going to enjoy it to the fullest. We have a fantastic session ready for you today. The title is Man's Not Hot. We're trying to be down with the kids, you know, even though some of us are not children anymore. But we have a fantastic session. Now, I was told that the men, because this is a topic about men's health, have hidden. And they didn't want to be involved in this session. So maybe as you're listening now, you can send a link to your friend, or you can post the YouTube link online, because we need people to be involved. And even after the session, please send it to all your contacts, because it's going to be great. So without further ado, I'm going to introduce our speaker. So as I was speaking to him before, he told me his accolades, and let me list them in order of priority. So he is a husband of 30 years, number one. He is a father of three now grown-up daughters. And as a hobby, he's a GP and a senior partner in Allerton and Westfield Medical Center. So we have somebody, and he's now my new parenting guru. So please welcome our esteemed speaker today, Dr. Abiye Hector-Goma.
Thank you very much, Ayo, for your kind introduction. Again, special thanks to CAHN, Caribbean and African Health Network, for this invitation. I hope my slide is visible to you. Can you see my slide?
Yes, we can, sir.
All right. Thank you very much. So yes, it's the session on Man's Not Hot. It's a kind of a revision of the session we had over a year ago, about a year ago. And I was thinking to myself that what can we say differently? How can we approach it in a different dimension? So I want to start from where we stopped previously. And the key points are: one, look after yourself, because if you take ill, there's a long wait in every place, whether it is primary care, community care, secondary care. It just getting the demand, the availability of appointments is getting thinner and thinner. Doing your best to have a healthy style is the key more than ever, because prevention is always cheaper and more effective than cure, and a stitch in time still saves 9. The next point is practice self-care. If you have a headache, which started this morning because you'd had a late night, Just some adequate rest, drink some water, maybe take 2 tablets of paracetamol is what you require. So practice self-care. If you had a little cut, a bruise on your elbow, learn to manage minor ailments, or you can seek the help of your community pharmacist. Embrace care navigation and save GP appointments. Maybe 50 years ago, for everything you had, you went to see your GP. But now in the practices, you have more than the GP and the nurse. You have pharmacists, you have mental health practitioners, you have physiotherapists, you have healthy minds worker, mental health practitioners. So the former receptionists are now care navigators. We call them patient support team, and they've been trained based on little information they get from you to navigate you to the best part of the primary care team. So embrace care navigation and save GP appointments for the frail patients, those with more complex problems. Health screening saves lives, and you ignore it at your peril. And if you have the resources, whether at work or personally, get private insurance. If you have private insurance, if you can afford it, you can speed up care when you need it. So I'd like us to have a few short quizzes as we go along this morning. And I would like you to quickly put an answer to the question, do you know your blood pressure right now? Have you checked your BP in the last 3 months? Just put in the charts yes or no. Have you checked your BP in the last 3 months? You can just put in the charts yes or no. Yes, Dr. Amona Gaspar is leading from the front. She's not just saying it, she's doing it. Sakinat, yes, that's fantastic. Okay, then if you answer any question, you can put where you're answering from. So I'm saying yes from Leeds, so you can put where you're answering the question from. Thank you very much to those who have responded. So we move on to the next slide. So this is our focus for this morning. An overview of lifestyle and health behavior. Man's not hot. The story. Acute and long-term conditions. Lifestyle and health checks for Black men. And then men, a call to action. So that's what we'll try and do in the next 25 minutes or so. So if you look at the man, he starts life with being a son to his parents, and then he's a brother if he has siblings, and then he becomes a husband, a friend to many. He would have colleagues at work, and Mother Nature being kind to him, he becomes a father. And of course, he himself is the man. So these are all the characteristics or the parts of his life where a man needs to prove himself as a man. If we go on then, the next one is the settings where you find the man. The first setting is at home, either with his parents or his siblings or his wife and children, and in the neighborhood where he lives, and then the work setting, and then where he plays. Some men go playing football on a Saturday or Sunday, and then if he has a faith, where he worships, where he goes shopping. So these are the kind of the settings where you'll find the man. And why I've put this is that whenever we're looking at interventions or activities for the man, we can look at the different settings and how the different settings can contribute to the man's well-being. Now, I saw this while I was looking at a few sites yesterday, and I find it quite interesting that when we talk about the health of the Black man, we always look at it from a negative point of view. All the statistics about the things that don't work, how we are marginalized, how this happened is being done to us, and so on. But I read in one of the sites, I think it was a Black Health UK website, and I found it quite interesting to look at the Black man from a strength-based approach and not from a weakness-based approach. You know, talking about thriving from survival to thriving. Because when we look at things from a negative point of view, I like this phrase, we have internalized racism. So when you hear things like, if I go to my doctors, they never take me seriously, we are internalizing the racism, but talking about how you now have a good relationship with the receptionist at work, how you and your GP get along, how the practice nurse is kind to you when she's doing your blood test. That is a kind of a survive to thrive approach. And that's a strength-based approach, which I would like to follow, you know, kind of a more of a positive message than the doom and gloom messages. So I want to use the Kinsmen of Leeds as an example. I'm a member of the Kinsmen of Leeds, and you can see me here in this outfit. So this is me. So the Kinsmen of Leeds is kind of an informal group of Nigerian and African men who are in their 40s to 60s. It's quite informal. We say this is who we are and this is what we do. And we're kind of involved in the Nigerian community. We're very active in the community for many years, from 1 to 2 decades and so on. And then we're also involved in a community interest company called Eagle Business. Many of us are involved in an investment group, about 35 of us. And then once in a while, we go out. I mean, last year, the group went to Cork in Ireland, and the next trip is being planned for the Gambia. So that is kind of the social and economic interest, and then as well as community interest. And then from a medical point of view, we've arranged unhurried GP consults, giving the members of the Kinsmen a chance to look at their life the same way you look at financial planning, to look at health planning. Once in a while, somebody will check his blood pressure and take a screenshot and then put it in the group where everybody will kind of do the same. And then people go and do PSAs and then come and tell others what their experience was. So this is a kind of a positive picture of Black men, you know, having social capital, looking after themselves, looking after their family, and being quite involved in the life of the community. So that's an example of the Kinsmen of Leeds. So health behavior and your health journey. The first part of the slide talks about living well. It's really important from a healthy lifestyle point of view for us to do, we have lifestyle medicine these days. The key things about living well, healthy eating, physical activity is about 30 minutes of moderate exercise on about 5 days a week. That's the kind of the good points you want to seize. At our age, sleeping for 7 to 8 hours, avoiding risky behaviors such as smoking, not drinking, or drinking sensibly. I think the latest advice is that even the 14 units of alcohol that is recommended a week, if you don't drink at all, it's even better than drinking 5 units or 10 units or 14 units. So not drinking alcohol is even better. You know, then having good networks, social networks, being happy at work, helping other people. And those are the kind of things that help us to live well. I already talked about self-care, knowing how to look after yourself. We have minor issues, maybe if you have kind of bloating tummy, a little bit of a pain above the belly button, maybe it's acid, knowing what to do if you have diarrhea, if you have coughs and catarrh, if it's hay fever season, if you're sneezing, kind of self-care, what to do, looking after yourself, to have that knowledge and then the skills and confidence. You don't have to go to the GP for minor ailments. You know what to do. And then when you have acute conditions, to know which of these acute conditions require treatment, self-care, when to go to the community pharmacy, and when to call your GP for an appointment. And then long-term conditions such as hypertension, diabetes, obesity, asthma, arthritis, and things like that. So all these bits on this flow chart, The key point is knowing how to overcome barriers. Many men do not go to the doctors until their sisters or their wives drag them to go and see the doctors. Why is this so? And what can be done to either avoid this or to actually learn to take action when required? Looking at the spectrum of health, we are all at different levels on the spectrum of health. At the bottom is those who are well or just have minor ailments who are at very low risk, all the way to those who are in intensive care, have had major trauma, or they are suicidal, is very high risk. So based on where you are, knowing what to do to look after yourself. Now, this slide is one slide that I like a lot because it helps us to look at health from a comprehensive perspective. So at the bottom of this building, the foundation of the building, what you cannot see, which is buried underground, are the social determinants of health. Now, 80% of our health problems are outside medicine, are outside medical help. 80%, only 20% of our problems can be dealt with by medicine. And that's why the people who live in the more deprived parts of town everywhere in the world are those who are going to be more unwell. And the social determinants of health affect a lot of us as people of African descent. So in terms of the accommodation, the homes that we live in terms of the work that we do, whether we're in employment or we are unemployed, even employment, how much control do we have at work? Are we employees who are working around the clock, having several shifts every day, trying to make money to send to family and friends? What is the quality of food that we eat? So these social determinants of health are kind of buried underground. They're not sexy, you can't see them, but these are the main things that influence our health. And then going on to our lifestyle, the diet, physical activity, and so on, which I already talked about, it is the social determinants, the environment, the economic environment that we live in. These are the things that determine our lifestyle and behaviors. And that's why, again, you find out that those who live in the more deprived parts of town are more likely to be the ones who smoke, are more likely to be the ones who do less physical activity. And then going on to the next level, so that's like the third level here, we now have the things that we measure: our weight, or our body mass index, our blood pressure, our blood glucose, our cholesterol, our kidney functions tests. So these are the things that happen next. And then going on to the fourth level, we now have the disease conditions: hypertension, obesity, prostate cancer, angina, heart disease, asthma, irritable bowel disease, irritable bowel syndrome, inflammatory bowel disease, going on to the head and neck, all that problems. And then at the top of the building is now where you have clinics and hospitals, which are primarily there to try and repair failed health. So the key point about this slide is that, number one, the base of the pyramid, the social determinants of health, are 80% responsible for our health and our wellness. So when we're looking at interventions, we should not look at just the roof of the building or the third or fourth levels. We should remember that the foundation of the building is what matters most. And that talks about, there are various behavioral theories, health belief model, theory of reason behavior. This COMBI, I just like this COMBI as health action model, and many others, the revolving door model and so on. But I like this one, this COMBI system. That's the capability. Do you have the physical ability? Do you have the psychological ability to take on the positive health behavior? Do you have the opportunity, which is the social opportunity, the environmental opportunity? There are some people that want to see a doctor today, they get to see a doctor straight away today. Other people will have to wait weeks and weeks before they get to see a doctor. So do you have the social and environmental ability? Because if you are in a deprived part of town where there are lots of patients, very few doctors who man those practices, then you have a much longer time to wait to see a doctor. You may have to see different people for several times before you get to see a GP or something. And then lastly, how motivated are you? Sometimes you have the automatic motivation, and then you have the reflective motivation when you find out that your neighbor or friend has had this problem. Maybe somebody you know has had a diagnosis of prostate cancer. Is your good friend. You now reflect on it. You say, wow, my friend has come down with prostate cancer. I've not done a PSA. Maybe I should go and have a PSA. So you reflect on the situation. And some people will say that I'll call my GP, and then they don't do anything about it. So that is the issue about automatic, so reflective motivation. So quiz number 2, on the average, how many days last week did you get at least 30 minutes of exercise? On the average, how many days last week did you get at least 30 minutes of exercise? So either 0, 1 to 2, 3 to 4, 5 to 7. So let's just have a few responses. 0, 1 to 2, 3 to 4, 5 to 7. Wow. Ayo Latte, doctor, hosts, 5 times last week. You are a health freak, aren't you? Fantastic. Anyone else? I'm on air 3 to 4. Fantastic. Richard 1 to 2. Zana 3 to 4. Well done. Well done. So that's fine. I mean, I remember many years ago, and I think it still hasn't changed. They said physical activity is the best buy in public health. Physical activity is the best buy. If you're going to invest money on Russell 5 to 7, wow, that is a Guinness record here. Okay, so that's fantastic. Thank you all for your responses. So it's up to 5 times 30 minutes of exercise every week. I was just reading on LinkedIn about 2 hours ago that especially for those who are age 60 and above, that 22 minutes of exercise every day would increase your lifespan by a few years. So particularly those who are 60 and above, when you feel that you need to move less, if you're able to do this, you're going to live longer with your wives, your children, and your grandchildren. So yes, thank you very much for your responses. So the next slide is Take Off Your Jacket. I've listened to this song quite a few times, and I remember somebody saying that when the lady here, you can see, asked the gentleman to take off his jacket, it was like being in a warm place, and he said, man's not hot. And they analyzed it that in some parts of the world, maybe in some parts of London, young black men wear these to protect themselves from knife crime or being stabbed and so on. So sometimes man's not hot because if I take off my jacket, I'm going to be exposed. But man's not hot. Can we kind of hear that music for just one minute of that music, if possible? I'll just stop share. Can we hear that music for just 1 minute? So I got this from blackmenshealth.org.uk, and as I said, to try to approach this talk from a positive point of view. And the real message I would really want to leave with us as we progress is please be proactive. Please be proactive about your health. Please be proactive about your health. Do not wait to be told. Yes, there is racism as a public health crisis for Black men. Yes, we are tired, traumatized, and fatigued, according to Black Britons, in the ongoing fight for mental health rights. But please be proactive, and there are some things which are your rights. Know them and then get them. So I come to this slide, which I looked at what are those issues about health which are peculiar to the Black man. And of course, there are 2 things I looked at here. The first one is from the brain, the mental health. There are specific challenges, both social, cultural, and environmental. There are specific challenges which are innate to the Black man. And then coming down below, from the bladder, the prostate, the testicles, the urethra, the penis, there are specific challenges which are the issues with the Black man. And then on the left side, I made a list of the various organs of the body and the systems. So remember, eye check every 2 years. You should have a routine eye test. You should see your dentist once or twice a year. If you can have your hearing checked, the older you get, make sure that you can feel your neck. There are no lumps or bumps on your neck. Make sure you don't smoke. Protect your lungs. Keep active, protect your heart and your bowels, the symptoms are that the bowel is moving too fast, it's not moving at all. Any bleeding is a red flag. If your poo there's blood in your poo, don't postpone it, have it checked out right away. Alcohol has an effect on your liver, particularly we as Black people, blood pressure goes higher. We have diabetes, more of a problem for us. So the combination of diabetes and or hypertension has an impact on our kidneys. And then, of course, living with obesity, I think statistics shows that we are more likely to live with obesity, and that could also link to hypertension, linked to diabetes, so-called metabolic syndrome, and then joints, skin problems. Sometimes it's more difficult for clinicians to make a diagnosis of skin problems with us because most of the research and knowledge is for lighter skin. So you do your own research. If you have any conditions, try and have a check. So these are kind of the key things which affect us on the right side, and then the general problems on the left side. So I already mentioned it, 45 years and above, as for a PSA, 1 in 4 of us as Black men would have come down with prostate cancer in our lifetime. And here I've put together a whole list of possible conditions that can affect the Black man. On the top, the problem with the prostate and lower urinary tract syndrome, scrotum, which last time we talked about the various symptoms for you to be aware of: pain in the balls, erectile dysfunction, premature ejaculation, other sexual health issues, infections, and so on. And then a few other conditions, hypertension, diabetes, heart disease, and the rest of them. So these are the conditions which for us to do something about. Now, I like this link. For those who've never gone to the Prostate Cancer UK website, you can proactively check this out. It's prostatecanceruk.org risk checkout. It's quite a good interactive website where if you go through, ask you a few questions, and I think that's something that is worth checking out if you don't know what the symptoms are and what to do about it. So prostatecanceruk.org risk checker. 2 more questions. When was your last full health screening? That's where you had your blood pressure, your HbA1c, your blood glucose, and your cholesterol checked. Do you have that in the last year, 1 to 2 years ago, over 3 or more years, or never? So just a few answers if possible. When was your last full health screening? Blood pressure, glucose, or HbA1c, cholesterol. When was the last time you had one? And because of time, I'll press on to this the lifestyle traffic audit. We talked about this before. These are the key things: diet, physical activity, sleep, social networks, weight management, alcohol, smoking, happiness, helping others, enjoying work. These are the key lifestyle measures. And how do you rate yourself? Will you say you're red, amber, or green? You're doing well in that area. It's really important because doing these things and being green in more of these areas is what will help you live longer, to be free of long-term conditions, or if you have long-term conditions, to be free of complications. So it's really important that your lifestyle, as much as possible, is kind of under your control. Diet is one thing that I have particularly experienced, that every time I eat less, I lose weight. I know people talk about obesity is multidimensional. There are 20, 30, 40 factors that link up to obesity. But I always say that on my part, whenever I cut back on food, I cut back on my calories, I cut back on the number of hours I stayed late into the night, which makes me snack. When I eat less, I go to bed on time, within a month, I lose some weight. So whatever the 1 million factors that affect our weight are, somebody said the biggest problem of the weight is in the kitchen. And from my experience, I believe that. So for all of us who are struggling with our weight, it's just worth checking how much are we putting in our mouths on a daily basis. So habits today to keep 999 away in latter years. Enjoy the weather, whether it is sunny as in Manchester or it's in cold as in London today, or it's nice and warm as in Leeds. I haven't gone outside yet. So wherever you are, enjoy the weather, get exposed to the sun, let the wind touch your skin, eat healthily, talk about physical activity, don't smoke, don't drink, and have adequate sleep. When we try and form these habits today, a lot more of us are going to keep 999 away in our latter years. NHS health checks are free for everybody from age 40 and for every 5 years, unless we now have a long-term condition, then we need to be seen once a year. So again, if you're age 40, age 45, 40 and above, if you've never had a health check, please go and book one. It is free on the NHS. It will help us to prevent diabetes, heart disease, kidney disease, stroke, and dementia. And if you have them, we are in my practice, we have about 650 patients who are living with diabetes who have been diagnosed. And many of them, it was just their normal NHS health check where they found out they had raised blood sugar, they had no symptoms. So please, your NHS health check, please, we talk about the PSA from age 45, NHS health check from age 40, and then you have the bowel cancer screening. Some places 55, some places 60 years, but have your bowel cancer screening. That's the next test that you need to have. So, last question. Do you know your PSA level as a man? Do you know your PSA level? And when was the last time you did it? Do you know your PSA level? So, all said and done, the root cause of many problems is blockage of the arteries, narrowing of the arteries, plaque formation, and that's where the lifestyle we talked about is key. And I want to finish on this slide, disposable income. At the end of the day, we don't talk about this much, it's not medical. But when you've paid all your bills, having some money left when you've paid all your bills shows financial frugality. You are more likely to make better health decisions when you have disposable income. But if you're in debt, you don't have any money to meet your basic needs, that causes stress, that will make you eat junk food, that will make you not have good sleep. So understanding money, having disposable income is one important way of improving the health of the Black man. And this is the final question. Would you join a health accountability cycle with 3 to 5 other men to keep each other on track? Would you join a health accountability cycle? I talked about the Kingsmen of Leeds, that we kind of have that relationship where we are accountable to each other. So we like to have that. So in conclusion, Black men's health, proactive is the word. The power is in our hands. Yes, there are barriers, but that's no excuse. Yes, the system may be against us, but that's no excuse. Get checked, stay checked, and live checked. And if you have any challenges accessing those checks that are your right, such as your age 40 NHS health check, your age 45 PSA check, your bowel cancer screening, speak to somebody, get in touch with CAHN, get in touch with us. As a GP, I'll be able to advise you on what your rights are. No man should be left behind. So our sisters are here, our wives who are here, our colleagues who are here, the man in your life, check if he's had his NHS health check. Ask him if he had a PSA test. No man should be left behind. Know your numbers, know your blood pressure, know your HbA1c, what's your weight or your BMI, what's your cholesterol level, what's your EGFR or kidney function. You have to know these numbers, the same way you know your house address, you know your the balance in your bank account, know your numbers. And then you can pick one habit this month. Just pick one habit, whether it's to walk, whether it's to jog, to eat greens, to drink water, to cut sugar, to manage stress, to sleep better. Just pick one habit this month and bring a brother along, because health is a team sport. Thank you very much. So I'll just bring this talk to a close and then we'll take questions.
Dr. Hector-Goma, thank you so much. I hope everybody who is on this call has realized the many nuggets that Dr. Hector-Goma has dropped. I've been making notes. So no, you're speaking my language, sir. So I really appreciate it.
Thank you.
You know, everything that you've said. I think, I mean, we're going to have some questions um from the people who are listening and the social media, but I have a question if I can start. So
Okay.
obviously you have years and years of experience, but you've got years of experience at different levels. So you are a black man, you are a GP, and you are a father. So, like, I have wondered whether there is an avoidant behavior in some of our brothers. Can you speak to that, in the different spheres of life that you represent?
Well, thank you very much. I mean, I quite agree with you. I was thinking about this yesterday. For example, many people who are originally from Nigeria have
Mm,
come into the United Kingdom in the last few years. You know, who had excellent jobs, working in great places, and they've come to the UK hoping to kind of as economic migrants, and many of them have kind of struggled to find their feet.
mm,
Thank you very much. So I was saying that many people have come into the UK, economic migrants who have things going for them, and they've come into the UK, and life is really tough for them. Now,
mm.
that kind of man, asking him to go and do a health check is
Yeah,
kind of the least of his priorities. I have patients
exactly.
who are trying to get their visa stuff sorted, trying to get their stay. So when you invite them for health checks, they don't come. And that's what I talked about, the social and environmental opportunity. And then there are those people who I know a man who has refused to do his PSA. He's about 60 years old, he's my patient. You know, what I do is that when I see black men in clinic, I always check their record where they've done a PSA. If they haven't done, I look at their age, I offer it to them. And in the last year, I've seen a man twice and offered him a PSA, and he has refused to take a PSA. And the reason is that he does not want to find out
Mm,
that he
mm,
has prostate cancer. And I keep on saying
mm.
that, is it not better if at
To
all
know.
is you have to catch it early than to
Yeah.
catch it later? So this is where the various health behavior models come in,
Mm,
trying to understand what are the barriers people have, speaking to those barriers and helping
yeah.
them to overcome those barriers.
Absolutely. I think that's really key, because and I really liked the presentation that you did about the house,
Yeah.
because I think sometimes in our community we can measure on minors. And I think in society at large, as a doctor, I'm often um um mystified by somebody who is engaging in something that is detrimental to their health, but coming to me and asking, "Oh, can you help me?" I think the figure that you gave, I've got the notes here, 80% of health problems, as I
Outside the
understand
health
it,
sector.
outside of my sphere of influence as a doctor.
Yeah.
And I think that's why I really appreciated it, for everybody who's listening. One of the things I love about the Cannes Health Hours is that there's often a charge in terms of people taking responsibility for their health. It's your life. Dr. Hector Goma and I can only do so much when you come to us, but we're not going to have to live your life. We're not going to have to deal with the consequences of not checking the PSA, not checking your blood pressure, and avoiding doesn't 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 make the problem go away. My auntie said that, especially for those of us from, Nigeria, that maybe historically, um, admitting to a health problem would have let your enemy know your weakness. Like, is that is that part of the is that contributing to it? You think we're still thinking in terms of things that aren't necessarily pertaining to modern modern
Yeah, it's
medicine?
interesting you say that. But I mean, again, this is a Nigerian script, religious phrase.
Mm,
You hear what a lot of people say, it is not my portion. They
mm,
say that my enemy has a headache,
yeah.
things like that. So
Yeah.
many people of faith, quite
Mm,
rightly, how do they put it? They confess positive, But by
Yeah.
confessing positive, they don't take action. Somebody said it
Mm.
can be of faith. There's the so-called 6 o'clock Christian, and then there's the 12 o'clock Christian. The 12 o'clock Christian is all prayer, and that's all faith, no work. While the
Yeah.
6 o'clock Christian has one hand praying and the other hand doing work.
Working.
And that's what
Yeah.
I think
Yeah.
is really
Yeah.
important. Whatever your faith is, your
Mm.
faith has to be activated by doing what you need to do. Have
Absolutely.
that check. If you have a
Yeah.
free NHS check, go and have it done. If you're living with diabetes, you have a right in the UK to have a
Mm.
check twice a year. That's your right. There are
Yeah.
about 9 indices. You have a foot check, you have blood pressure check, you have all these checks. It's your right. You don't pay a
Mm.
dime for it. Do
Mm.
not, some people say, I've had your eyes tested. Say, oh, I'm not bothered. But if you're diabetic, you don't have your retina screen every year, you
Yeah.
can
Yeah.
end up having damage to the retina. You can go
Yeah.
blind. And those are the kind of things that one people do not have the knowledge, but some have
Mm.
the knowledge and have those barriers which they need to overcome. But it's really important for us. That's why I wanted to focus more on overcoming barriers against this
Absolutely.
talk on the medical things. That these are the people have been talking about prostate cancer in the Black community for so many years, and
Mm.
many of us are still not coming out to have the checks done. We
Yeah.
come out late, we have poorer outcomes. And that's why it's really important for us to know about the psychological aspects of health
Yes.
and how
Yes.
to overcome our barriers so that we can do the right thing on time.
Absolutely. And I really appreciated the language you used at the beginning when you said prevention is better than cure, but you also said it's cheaper. And I think
Yes.
that the language, especially specifically when we're speaking to men, is different than the language that we use for women. So if I can give a quick example. So my dad didn't really do lots of housework. But what he would do is every 3 months he would clear everything and he would sweat and this. And then my mom would be like, well, if you did it every day, you wouldn't have to. So they're coming from different points of view. And the thing that motivates a man to action is different than something that motivates a woman to action. And I think, it's important for us to get the message across. If you're thinking about money and investment in your lifetime, catching something late and then having to deal with the consequences of a late diagnosis and all of that is much more expensive than actually just checking and finding something early or being proactive. So our brothers, please, 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 it's cheaper to know now. I love what you said about community, in terms of health accountability. So to your point, you mentioned about my 5 times. So spoiler alert, in 2020, I had a stroke. And as a consequence of that, I now joined, we call it the 100 Club. It's a bunch of men in their 40s trying to relive their youth. So the reason I do it is because I'm in a group of people who we've agreed. So we'll do the exercise, we'll post it, and then for the sake of accountability. So I think it's really important, especially for men, because community does help. How have you seen the benefit of the Kingsman in Leeds?
Oh, it's when you talk about social capital, in
Mm.
fact, today we're at 2 p.m. today, we're going to visit one of us who lost his brother. So it's a kind of it's a comprehensive package. We have the WhatsApp group where, when boys talk, they don't talk politics. So we talk about everything in the WhatsApp group, and then once in a while, somebody
Yeah.
hosts the Kingsmen, and we
Mm.
come at 9 p.m. and we spend the whole night solving the problems of the world. And then we leave 2, 3, 4 a.m. planning to continue in a few months' time. And of
Yeah.
course, the issue about once in a while we take a walk, but the issue about somebody just checks his blood pressure randomly, and then we're all kind of encouraged. Somebody goes to do a
Mm.
PSA test, comes back, puts it in the group, and they say, who else, who else, who's next, and so on. So that communal spirit is
Mm.
quite important. Sometimes
Yeah.
you can't walk alone. Having somebody who you're accountable to, like you mentioned, Ayo, there, is
Mm.
actually a useful thing for us to do as Black men.
Absolutely, absolutely. And again, I love that you mentioned about social capital. You also mentioned about finances. One of the things I've been saying, for years is that if you track any medical condition and you track it by income, the
Yes,
people who earn less are always have worse outcome. So
true.
it's not a pride thing or it's not even big manism. To want to have longevity And to be healthy for longer, it's sensible for us to be um, intentional about our finances. The thing that I say in the 100 Club is that the journey to being a fit granddad starts today.
True.
I can't wait for me to be 75 or whatever before I do that. We have a question in the group. I believe it's Dr. Gasper.
Okay.
It says, thank you, Abiye, Dr. Hector-Goma. A very informative session. We all carry our trauma differently. So how can mums, sisters, aunts help our men to take off their jacket?
Okay, that's a good one. I think there are a few options we can look at. One is, from my experience, and I think it's the same thing for most men, we don't like to be nagged. Don't nag me. I hate it.
Mm.
I mean, I don't like it at all. I've been mothered long enough by all the ladies in my life. So approach me kindly find a positive way. Somebody, I think, let me just digress. Somebody once said, when you enter your teenage child's room, find something positive to say. And if the whole room is upside down, say your ceiling looks nice. Say something, so say something positive. So if you know I'm due for a health check, find something positive to say and then slip it in. You can say something like, in fact, I'm booking an appointment next week to go and have my smear done. How about you come in with me and then maybe you can do your PSA on the same day. I can book the appointment for both of us. I mean, that's a kind of a positive way you're going, so let's go together. So I've had a few patients who come and say, I don't know why I'm here, but my wife said I should come. And that's why I'm here. And I tell him, good man, the man who does as he's told is going to live long. So, so if you can, book an appointment with him when you are
Mm,
going for your appointment. So you're not like sending him off, you're going with him. And if you pick up anything nice, go and put it, like sugarcoat it and encourage him. So in a positive way, encourage. And when he's done something, like if you check your blood pressure, tell him, come on, let's check our blood pressures together. And
mm,
if his blood pressure is high, say, wow, this is elevated. Let's go and do something about it. So that's what I
yeah.
would suggest, Monia, in terms of at the end of the day, like I said earlier, that most of us do as we are told, even though we'll grumble about it. Ultimately, most men, when their wives or their sisters tell them in a nice way, will go and do as we're told.
Yeah, I think that's really great advice. If I can piggyback on that, I want to introduce the concept of emotional intelligence,
Oh, yes.
and on both parts. So, for instance, as a man, if I am anxious about something but I haven't acknowledged it, when you come and give me something that's even nice, I might overreact. I might push back. And it's only because I am anxious. So that it requires me to do the work to be a verbal processor. So actually this is how I'm feeling. Babe, I'm gonna get my PSA checked. I'm a bit concerned because I heard the data about 1 in 4 black men have will develop prostate cancer. So I'm just a bit anxious about it. That is a more open and honest discourse than my wife saying, "Go and check it," and I'm like, "Leave me alone." Like, yeah. And on the other side, there's the so I had a friend. His brother is overweight, and he was saying that I keep telling him go to the gym, and I'm still and I was like, I understand what you're saying, but what you're not articulating to him is that, bro, I love you. And I am concerned that this thing is going to take you away from me sooner than it should. I'm concerned about your health. Because if you just shout at him, he's going to match the energy. But if you find a way, and maybe that's what mums and sisters and aunties can do from it. So you are concerned. We get that. But there's just like Dr. Hector Gomez says, there's a way to approach a man that, doesn't cause him to um, put his defenses up and then shut you down. Um,
Uh, yeah, then Russell has put a very important point here. He said, don't just get the test done, get the result and know the
mm,
significance of the
yeah,
numbers. A GP
absolutely.
said a score of 7 plus for years is nothing to worry about till probed. Now, information is so widespread now, and then we are going to have problems as clinicians because people are now testing their symptoms on ChatGPT, DeepSeek, and coming to us with a lot of information that we are struggling with. But it's really important. I have one patient, he was on the call last year. He's a black man, he's about 70 plus. he's the most challenging patient I've ever had in a
Mm,
nice way. He he wants the details. He wants
mm,
to know exactly what you're talking about. If you use a word,
yeah,
he said, explain that to me. He
mm,
will come with questions. He said, look, I had an MRI scan 2 years ago. And, so he has all that knowledge. So
mm,
whenever he's coming to see me, I go to his records with a fine toothpick so that whenever he comes,
yeah,
I have answers for his questions. And I kind of like it because he's well informed. He says it's his life.
mm,
He will ask a question. He goes to see a consultant, he will ask questions. And that's why I think it's important. When you do a PSA and you're told it's this, do your blood pressure, it is this, go and check it. What is normal blood pressure for my age?
yeah,
So learn to educate yourself, have information, and
yeah.
then ask us questions in a nice way. Ask questions, ask us to break things down for you. It's really important. Don't just take the results and that's it. You've done the test. Know what the
Absolutely.
result is and what it means to you.
Absolutely. If you were going to buy a car, you wouldn't just go and the car salesman would say, "Oh, it's good." You'd be like, "Okay," and go and buy it. But
True.
the vehicle that you're going through life in, we need to do as much due diligence so we know our numbers. I always say, informed is armed. And this situation, just like Dr. Hector-Goma says, the world is changing. So us as doctors, I think maybe 50 years ago, 100 years ago, people weren't necessarily used to people to being asked questions and tell me about this and that. But we're used to it now, so there really shouldn't be a clinician that you're speaking to who has a problem with you asking for detail. There shouldn't be. And obviously there are ways of asking that's respectful and and that will get you the answer. But there's no reason in my practice. I love people when ask questions because it's more likely that that person is going to be proactive in the changes that they make in their life. So, Dr. Hatagoma, you mentioned faith. So I'm a Christian, and I pray, and I've had conversations with people about, oh, so I did a talk for CAHN, and we talked about end of life, and I got everybody on the call to say we are all going to die. And I heard somebody say, "Oh, God forbid!" Oh, no, 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 all this kind of stuff. So, our if we're not careful, our mindset will have a misappropriation of faith and a misunderstanding of what it means to align our faith and our health. Can you speak to that a bit more, please?
Yes, it's interesting. Yesterday in Leeds, we buried one of our pastors. He happened to be my patient too, and I was on call yesterday. I managed to dash out to be at the funeral, and it was a time to reflect. And like you said, the good book says it's appointed unto man, to die at some point. So we'll all die
Mm,
someday. 100 years from now, all of us will not be here. None of us will be here 100 years from now. So we're all going to die someday. So that's why
mm,
it's really important. But like I said earlier at the beginning, I said, again, the good book says you shall know the truth, and the truth shall set you free. You
yeah.
know, um, in terms of health behaviors, it's always said knowledge comes first. When you have the knowledge, then you have the skills. And when you have the
Mm,
skills, you have the confidence to practice healthy living and doing the right thing. So the first thing is that you must have the knowledge that I'm age 45, I'm entitled to a PSA. You have the knowledge that I need to check my blood pressure. I've not checked it in a year. You have the knowledge that the normal blood pressure should be 135 over 85 or less at home. It's 150 over 90. That's not normal. So it's really important, and it doesn't matter who you are or what you are. I think again the good book is said, go and show yourself to the priest or something like that. So
yeah, yeah, yeah.
again, it's really important. If you have diabetes, let's just imagine you say you've been healed of diabetes. I'm not arguing with you. Go and check your HbA1c. Your doctors will tell you that you're in remission.
Mm,
But you can be healed spiritually. In your
yeah.
spirit, you feel well, but HbA1c is sky high. You need to take medication to bring it
Mm,
down. It doesn't stop
yeah,
your faith.
yeah.
So you need to understand that one is the body. The body needs to have those indices corrected. You can't have blood pressure, which is sky high, and you're telling yourself you're healed. That's foolishness.
Mm.
So it's really important to have the knowledge and then balance your miraculous with the facts on the ground.
Absolutely. I've been saying for a long time that if so I believe God does miracles and that if God does a miracle, you should be able to prove it. It's not just about, oh, I feel better. No, if the issue is a measure, then if God has done something in your life, you should be able to measure it. And the reality for a lot of us is that the thing that we are articulating is a fear, and it's a mental issue, not a spiritual issue. So because I'm scared of if I have this or if I have that, or I'm scared of finding out, I'm going to spiritualize my fear by not checking or by not taking my medication. Whereas in reality, I don't believe that avoiding the issue is what God wants. And faith doesn't deny the facts. It's knowing what is the problem that gives me what I'm supposed to pray for or to talk to God about. So, I 100% agree. We shouldn't put our head in the sand. We should know. We should know. We should know. Another comment here. Thank you so much for your brilliant presentation. I turned 50 this year. Prior to that, I asked for a PSA test from my GP. He told me that I didn't have to do one if I'm feeling healthy. He said the reason is because the test is not very accurate and gives lots of false positives that could lead to other issues. I would appreciate if you could comment on that. That's from
All right.
Rodrigo.
Good point, Rodrigo. I was looking at the Prostate Cancer UK website yesterday. They said there should be a decision sometime. I don't know if that has happened, but sometime this year, there will be a decision whether prostate cancer screening would become a universal test for men. I think Prostate Cancer UK had put £42 million into an ongoing transform study. But the current advice is that um, you may not have any symptoms at all. There's IPSS, which is, you can Google that, International Prostate Symptom Score, IPSS. Now, that will give you a score over 35. I think 7 or less is normal, and then you have mild, moderate, severe symptoms. Currently, PSA is the only test that is available. It is not a good tool, but it is the only thing that we have. So the current advice is that if you're a black man, because we have 1 in 4 chance in a lifetime, even that's without even adding if you had a family member who's had prostate cancer before, that even increases your risk. But the current advice is that if you're 45 and over as a black man, ask your GP for a PSA. That's the current advice. And if many of us as GPs don't have that knowledge. So if your GP says what you've just mentioned, Rodriguez, there on the Prostate Cancer UK website, there's a template letter which you can download and put your details on it and send to your GP. As a black man from age 45, you can ask your GP for a PSA and he or she must give it to you. They can tell you what are the pros and cons, but ultimately, if you want it, no GP in the UK should stop you from having a PSA. That's the current advice.
Absolutely. And again, it's back to the point we were making before about it's your health, it's your life. Now, and again, I'm not debating that there are times when there's maybe some friction in the system or things that these things happen, but just like you would advocate in another situation for your friend or your mother or your brother or your dad. So we need to learn how to advocate for ourselves. And one of the ways is navigating the NHS structure when maybe we're getting resistance to a test that we think that we are entitled to. The thing is just remember that the GP is human and everybody knows what they know. And you can stand your ground respectfully and say, well, I'm aware of data. And just like Dr. Hector-Goma says, specifically about PSA, the Prostate Cancer UK will give you the information and the verbiage to go and to have a conversation with healthcare. So we're almost at the end. I'm making sure that I have addressed all the questions. Do you have? I also loved what you said about the change one thing. Because I think sometimes when it comes to healthcare, it can seem like, oh, there's so many things. I've got to eat green and I've got to exercise and I've got to drink water and I've got to walk upstairs and I've got to run to Mars and I've got to all this kind of stuff. So, if somebody here, so you've got a gentleman who's black, who's 45, and they haven't really taken their health seriously at all, what would be the first thing that you would say in terms of changing one thing?
Well, if for the 5-year-old, I believe that lifestyle is the most important medicine for every one of us. So the first thing I would say is the traffic score thing, the particularly healthy eating, physical activity, and adequate sleep. I would say those are the three most important things. Of course, before that is economic, improving your disposable income. But in terms of changes you can make, I would say between healthy eating, physical activity, and 7 to 8 hours sleep is what I would say as to start with. And then from a health point of view, have it an NHS health check. And when that is being done, request a PSA. Maybe request it when they booked you for an NHS health check, if you're 45, request a PSA ahead of it so that the healthcare assistant can discuss with her GP to say, this man is coming for a health check, he has asked for a PSA, and then make sure that PSA is done as part of that check. Somebody has asked a question, I think Russell, what data is there in terms of false positives? I mentioned that the PSA is not a good test, but it's all we have. Up to 75% of positives are actually false positives. It's up to 75%. And then up to 15% of negatives are false negatives. One of the advantages that have happened in the world of prostate cancer is that before, you do a PSA test and then your GP would have to do a rectal examination. Many men refuse to go for PSA because of the fear of the rectal examination. A rectal examination is no longer required in the UK as part of prostate cancer screening. If you go for a PSA, your GP wants to do a rectal examination, tell him or her nice that they're a little bit outdated. You no longer need a rectal examination when you're doing a PSA test. The other benefit is that people were having unnecessary biopsies. Now, when you have raised PSA, the urologist, the next thing they would do is to do a parametric MRI scan. It is only that MRI scan that will now determine whether you need a biopsy or not. So if you have false positives, the worst thing that will happen is that you have an MRI scan. If that MRI scan is normal, they just discharge you and maybe ask you to do a repeat. There are a few things that can cause elevated PSA, but even though we have a high level of false positives, there is no rectal examination required. There is no automatic biopsy. It is only the very specialized MRI report that will now determine whether you need a biopsy or not.
Wonderful, wonderful. So, there's a question here. How often would we need to go for a PSA test? I believe that you said it would be yearly above the age of 45. Did I
No,
misquote
I
you?
think you do a baseline, and I think it's after the baseline that you now based on what
Determined. Okay.
outcome of that is, yes.
Yeah.
But I think it should be
Wonderful.
about every 5 years. But of course, if you have symptoms, then you want to do it sooner. But have the baseline done.
Fantastic. Well, I'm full. Dr. Hector-Goma, I want to thank you for your time. I want to thank you for your experience and your wisdom and your articulation to help us understand these issues. Yeah, I want to thank you, for your experience in dealing with men and helping us, bring our brothers along because we need to start taking better care of ourselves. So thank you, thank you, thank you very much.
A pleasure.
And on behalf of CAHN, I want to thank everybody for signing on to this health hour. And if you're listening online, thank you for listening. You're being proactive in your health, and it's really important because as we get healthier in the community, it's better for everybody. I want to remind everybody about the Black History Month Gala 2025. The nominations are closing soon. So the tagline is, "Who's your community hero?" Is it Dr. Hector-Goma? Is it anybody else? Who's fighting change? Whose outstanding leadership deserves recognition? In the chat, there's a link that you can click on and vote. And it's really important because, sometimes people are doing really important work and we are not aware of it, or they're not getting the recognition they deserve. So we thank you, CAHN. We all watch the Oscars, we all, the I don't know, BT Awards or whatever, but are we celebrating our heroes in healthcare that are literally trying to save our lives? Let's get involved and vote. And again, I want to thank everybody for the time. And this is both myself, Dr. Abiye Hector-Goma, and Dr. Hector-Goma and CAHN signing out. And we'll see you next time on the CAHN Health Hour. Have a great week, everybody.
Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.